Hi, my name's Will Bauer, and I'm a teacher in Battleground Public Schools in Clark County. Back in December of 2020, uh, I noticed that my local health department started removing info about COVID cases in schools from their website. I filed a public records request for a number of COVID cases and the number of quarantine staff and students to get the information they had stopped sharing publicly. Then on December 16th, Inslee changed the metrics for school reopening at a time when the virus was surging across the state. He pointed to districts like Mead near Spokane, which had defied their local health authority and started the school year face to face in September. We were assured that staff would be safe returning to schools based on the success of districts like Mead. I started to dig deeper into data around COVID in schools and sent public records requests to all county health districts in the state. By July, I had heard back from most of the public health districts. Only 18 of 36 health districts, 50%, were able to report how many cases of COVID-19 had been brought into schools and how many had to quarantine. When I shared the data, teachers from across the state reached out to me to share cases that went unreported. One such case was in the Mead School District Central Office, which led to a staff member's death from COVID-19. This school staff death had not been reported publicly by the school district, Spokane County Health Department, or the Washington State Department of Health. In his presentation, December 16th, the same day that Governor Inslee changed the metrics, Mead Superintendent Sean Woodward mentions this outbreak. Let's go to that video now.
Definitive spread within schools thus far has been between staff, and that's been very small. Let's see, we've had roughly, I want to say of the 237, it's been 50 staff members. We can identify 5 of those staff members that got it from within the school system, and we've been able to identify that it happened at lunchtime without masks, so we're adjusting those practices. We've been able to definitively say that there has been not been spread student to student or staff to student or student to staff. Now, we have had to, in the past week, take a little bit of a pause, and we're not tracking internal spread versus external spread right now because our county can't keep up with contact tracing because our rates are so high.
One of those staff members involved in that outbreak was Richard Sacamano, and he died 3 days later on December 19th from COVID-19, according to his obituary. He had a brief but fierce battle with COVID-19. He passed away at home, and it says here that he was working at Mead schools until he passed. There had been an outbreak among the technology staff at district office, and they had to quarantine everybody who worked there. And one of the people involved in that outbreak was Richard Sacamano, and he died 3 days later after the superintendent said that it was safe. What they were doing was safe. They were following all the protocols. Everything was safe. The public was unaware of his death because the Mead School District's data dashboard doesn't include cases that occur at district office. It has cases at each of their school sites, but not district office. It was not reported to Spokane Public Health, and it wasn't reported by the state of Washington Department of Health that an outbreak that occurred at a school building led to someone's death. At the time of his death, cases were at 900 per 100,000. people, and they had increased from 230 at the beginning of the school year. So in that few months, the cases had quadrupled, and the vaccine had just been released but wasn't available for school staff until March. Regardless of this information, Mead School District was still used as an example by special interest groups, parents, school leaders, media, politicians to push other schools to return to face-to-face instruction, unaware that a staff member in that district had died from COVID-19 from an outbreak that occurred at the district office. This piece by the Seattle Times editorial board shows how central Mead School District was to this narrative. So their headline is, "Teachers Unions Soften Your Vaccine Stance so you can go to safe in-person instruction." They use Mead as their first district as an example. They say, clearly, safety precautions are working. The contact tracers identified only 5 cases of in-school transmission. Reminder, they paused that work because they were overwhelmed at the same time that this staff member had died. We can't leave this contact tracing, we can't leave this burden onto schools because they'll hide data that the public needs to know. So clearly the superintendent would have been aware that someone in his office had died from COVID. Regardless, he goes on to say, "I'm a little disheartened and disappointed that there aren't more students in Washington back face to face, given there are so many models of how to do it safely. If you are serious about following through with all the guidelines, you can do it in a way that everyone will be fine." An employee in his office where he works had died from COVID-19 from an outbreak that affected at least 5 people. And he says, everyone will be fine. Give me a break. School leaders who push reopening say one thing in public when they know the reality on the ground is much different. The way COVID-19 cases are reported in schools needs to be drastically reformed for the upcoming school year. We can't rely on schools to self-report. When COVID-19 exposures do happen, will cases, outbreaks, even deaths continue to go unreported?